Okay, so one of the members asked a question that in septic shock, when the patient's blood pressure is not picking up, you have given crystalloids, you have started increasing the vasopressors, and still the blood pressure is not picking up. So at that particular position, we add steroids, usually hydrocortisone in that situation. So why not we use albumin in that situation rather than why we are using steroids for that particular matter? So understand that steroid means hydrocortisone and albumin, which is a colloid, are serving two different purposes. So whenever a patient's land in septic shock, it is a stressful situation for the body. And we know that in stress, we need steroids either as a fight or flight mechanism to cope up with that particular situation. And blood pressure maintenance is one of the requirements which the steroids perform the action in that particular position. So usually the patients who are so sick, so critical in septic shock, they are not able to secrete that much amount of steroid which is needed to maintain the stress dose response in that particular patient and maintain the blood pressure. So we just give the stress dose steroid in such patient, which is hydrocortisone 50 milligram 6 hourly, which is equal to 200 milligram. We don't give steroids as 300 milligram or like that. We just maintain the stress dose steroids, which is needed to maintain the blood pressure, which is needed to maintain the body for coping up the stressful situation like septic shock. At this dose, whatever the data says that it doesn't hamper the immune system of the body. It will not bring or suppress the immune system so that the body is not able to fight with the sepsis or infection, or it will flare up the infection like that. This will just maintain the level of steroids in such a level that body is able to cope up with the stress and maintain the blood pressure. While albumin doesn't have to do anything with the stress response. If the stress response of stress dose of steroid is not there in the patient body, not able to secrete either by the own or supplement from the outside, no matter how much fluid, no matter how much colloid, which is albumin, no matter how much vasopressors you do, the patient will blood pressure will not pick up. So albumin is needed when you feel that patient is having hypoalbuminemia and the patient is not maintaining the intravascular compartment of the body, like cirrhotic patients or very malnourished patients who are nutritionally deficient. So albumin helps to maintain the oncotic pressure in such patients, and you need to assess it on case-to-case basis whether we need to use albumin in that or not. So albumin can help in bringing the oncotic pressure, but it cannot replace steroids or hydrocortisone in that particular scenario. So I hope this clarifies, and thank you for asking. And do read more about it. Thank you.